It's time again for Health Monitor, the #1 program that shows you how to live a life in its healthiest way. To improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day. It's Health Monitor, yeah. Your guide to good health. It's Health Monitor, the #1 health show, yeah.
Hello, it's time for Health Monitor once again. Thank you so much for finding time to join us on today's package. As usual, we have assisted conception brought to you by TrueCare Fertility Clinics, and then we have health insurance. Okay, and that information is brought to you by Life Care Partners. Then we're looking at body care, and today on body care, we want to tackle weight management, all right, due to popular demand. All of this after this break on Health Monitor, your guide to good health.
It's Health Monitor, the #1 health show.
Memories are created daily from events, photo, and video shoots. Having the perfect studio, equipment, and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo, and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Akme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
It's Health Monitor, the #1 health show.
Since there are two tubes, if a woman has one of the tubes blocked, then there's a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered.
Many women go from one hospital to the other, trying to cure what is not actually a disease.
Good day, viewers. You're welcome to the assisted reproduction segment of this program, and I'm Dr. Ivy from TrueCare Fertility Clinic. So today we are going to be talking about premature ovarian failure and menopause, and I'm going to tell you how this affects fertility in a woman. What is premature ovarian failure? A number of women suffer from this condition and they may not even know what it is. They don't understand why it's happening to them. They don't know what it's about. Some of us may have heard about it, but we don't know, is it the same thing as menopause? Or is there any difference between premature ovarian failure and menopause? So I'm going to be talking about this in today's edition. What is premature ovarian failure? It's a condition in which a woman who is less than 40 years of age suddenly goes into menopause, meaning that her period suddenly cease. Following, there's no form of there's no ailment, there's nothing that caused it to stop or whatsoever. She just suddenly stops seeing her period, and when she goes to the clinic, they tell her hormone levels are like that of a woman who has gone into menopause. That is premature ovarian failure. So when a woman is less than 40 years of age and she suddenly goes into menopause, having all the signs of menopause, how does this differ from normal menopause? Menopause is a natural occurrence in every woman, and it's usually between the age of 45 to 55 years of age, 45 to 55 years, with the mean age being 51. Menopause is the end of reproduction in a woman. It's a time whereby her eggs are exhausted. She has released most of her eggs during her ovulations previously. So at this point in time, natural conception is supposed to be impossible because she no longer have eggs, and her body is preparing to rest. What are the symptoms of premature ovarian failure and that of menopause? Both are the same. In most cases, premature ovarian failure, they have the same symptom of menopause, which is the hot flashes. She feels very hot, hot flashes, then night sweats, you have the bone pains on some people, you have cramps in the joints and all of that. You have then the cessation of the period is there as well. So what is the cause of premature ovarian failure? Since menopause is natural, but the cause of premature ovarian failure till date, it's unknown. Nobody knows why it happens. Sometimes it's reversed spontaneously as well, like the ovary gains its function again. But most times, the function is lost forever. So some people have linked genetics into as a cause of premature ovarian failure, meaning that it could be hereditary and it could run in some families, like some people say, and some others have said that it could be autoimmune. In some studies, they said it's autoimmune, but the cause generally is unknown. So how does this affect when it comes to fertility? When you have premature ovarian failure, it's almost the same symptom as menopause. So a woman who is less than 40 going into menopause, sometimes the woman could be in her 20s, she can be 25, she can be 30, and then suddenly she goes into menopause. And most cases, these women, they've not had a child, or some may have had one or two. But with these days, a lot of women want to go to school, want to achieve some things before trying to have children. And if someone who is predisposed to this condition may not be able to have a child once it happens, after achieving so much, and now you can't have a child. And I believe every home out there deserves to have a child, because we are in Africa. We can't rule that out. A child is a blessing for us here in this country. Some other parts of the world, they don't really consider having children a big deal. But where we are, children are a blessing. Some even say the more the merrier. And we also believe that when you're old, your children are supposed to take care of you. So a lady who now has premature ovarian failure, she has a challenge of having her child, which is a big problem. How do you overcome this? So most women they've gone into depression, but that's why we are bringing this information to you today, that there is hope. With one of the many modalities of in vitro fertilization, you can overcome premature ovarian failure. It can be overcome even when it comes to menopause. A woman who has gone into menopause can still have a child. At True Care Fertility Clinic, we had a 62-year-old woman who was over 10 years menopausal, and she had a set of twins with us. That was in 2014. We had that. So irrespective of your age, of your menstrual irregularities, of your menopausal status, or premature ovarian failure, you can still have your child with IVF. What is IVF? What are the modalities involved when it comes to in vitro fertilization? What do we do? There are options. There are so many options when it comes to IVF. There's a straight up IVF in which a woman's eggs are used with her husband's sperm. You also have room for what we call the donor egg. What do I mean by saying a donor egg program? A donor is a young girl who is less than 25 years of age, and then she comes to donate eggs for couple who are looking for who are not able to have their own eggs. So these are modalities that a lot of people don't know out there. You have that. You can have that. So when I say menopause is not a limitation to childbearing, so also it applies to premature ovarian failure. So if you're out there and you have a relation or a sibling or a friend who has had premature ovarian failure and she's wondering, where will my help come from? How do I have my children? Please tell her that there's hope. She can have a child. Like I always say on the show, there's no limitation when it comes to IVF. There's no reason why any woman shouldn't have her child. There's no reason why any couple shouldn't have the child. The only thing I seek most women to do is that please do come forward on time. No matter the condition you have, because once you have premature ovarian failure or you go into menopause, there's tendency for the womb to start shrinking, which is normal. Once the hormones supplying the womb, like when I say hormones, there are chemicals in the body that regulate the menstrual cycle. Because once a woman has gone into menopause, the estrogen level drops. You have very low estrogen level. That the estrogen is a hormone, a chemical in our body that makes a woman feminine. So you have the level of that hormone dropping very low. And as long as the estrogen level drops, then you have the womb becoming smaller. It shrinks. So and the same thing applies to premature ovarian failure. In premature ovarian failure, you have the womb starting to shrink after she has gone into that premature menopause. So in that situation, if you come forward on time, the shrinking of the womb may not be an issue, because if it just happened within 1 or 2 years and then you come forward, you want to have your child, you can still have your child without too much stress, because then you don't have to start giving too much hormone replacement therapy and all of that. But if you delay, the womb becomes so small, and then we have a lot of work to do before being able to achieve the pregnancy via IVF. So, like I always say, all my viewers at home, please take note that with premature ovarian failure, menopause, or whatever condition it may be, don't lose hope. Don't give up that you can't have your child. You can always have your child. IVF is a beautiful thing. It has put smiles on people's faces, and it's relatively a new technology. But so far, so good. There has not been issues, because most people are concerned that, with IVF, are the children going to be normal babies? Are they going to be healthy? Are they going to have normal IQ? Of course, yes. Studies so far done, there has not been any relationship between IVF and abnormalities in children. So, like I tell people, IVF is a beautiful thing. It has come to stay, and it has come to put smiles on the faces of women all over Nigeria, all over Africa, and I beg you to come forward on time. The earlier you come, the better. If you have siblings, if you have relations, please tell them about this. Premature ovarian failure is not the end of the world. No matter how high your hormone may be, like a menopausal woman's own, or no matter how deep into menopause you are, it's not going to be a problem. If a 62-year-old woman who was over 10 years menopausal could have a set of twins, I don't see any reason why a lady shouldn't have children. So I do beg you all to come forward and have your children. The beauty of IVF is that most times you have more than one baby at a time. Most times you're going to end up having maybe twins or triplets, and then it makes up for years lost. So it's a beautiful thing, and it's something that we should all key into. It's a new technology. The oldest IVF child is a lady. She has her own children now. She had her children through normal conception. It's not so you see that it's not compulsory that because you had your baby through IVF, meaning your children are going to have their own children via IVF. It doesn't work that way. So you see, like I tell my viewers at home, please come forward, spread the word, and expect a lot of blessings from God. Thank you very much, and God bless you.
Memories are created daily from events, photo and video shoots. Having the perfect studio, equipment and right team is everything. That's why I completely trust RWell's Media with my event coverage, studio space, equipment, photo and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. RWell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Akme Road, Agidingbi, Ikeja, Lagos. RWell's Media, solving problems, executing visions, and giving value.
Welcome back to the show, Help Monitor Your Guide to Good Health, and this is the body care part of the show. And today we're looking at weight management. All right, and I have guests here in the studio to take a look at that. I have a wonderful lady here. She is Lolo Abeke. You're welcome to Health Monitor Your Guide to Good Health.
Thank you.
And to Body Care. You're welcome.
Thank you.
And then I have Rema Okaibu. You have been a regular face on this part of the show, Body Care.
Yes.
And thank you for finding time to come again.
Thank you so much.
Okay, you're welcome. Right, so weight management has been an issue because some people say, look, including myself, we're trying to watch the weight, but the weight has refused to be watched. So it has refused to be watched. So I said, why not bring experts into the studio? Let's discuss this. Okay. So I want to begin with Lolo Abeke now. Why is it so difficult to watch the weight?
It is difficult to watch your weight to normal because the things that we, the wellness coach, will talk about natural things. They are actually difficult to do, but they are doable things.
Okay,
It's
so all hope is not lost.
all hope is, if you can do it, you can come down, your weight can come down no matter how fat you think you are or obese you are.
Okay, so Rema, why is it difficult to watch the weight?
It's just like those market women who goes to the market to buy farm things which they sell. If you notice, when they are coming back from the farm, the boss is usually overloaded. Why? Because they want to get the value of the money they are paying at the same time. Now, you find that most people get overweight because we want to get the value of everything we are paying for. Each time you go to the fast food joint, if they give you the portion which you're paying for, you want to request for more. So overweight is actually overload.
Yes, I agree with you, but sometimes you're at home, right, and you've made this nice food, and you've taken a plate. Why can't you just eat? You keep craving for more. That craving, where does it come from?
It just comes from the more.
Okay.
The more, because you actually need more. In fact, the body wants more because it's naturally programmed for that. It wants more. But
you have to discipline yourself.
You just have
no.
to discipline yourself.
Okay.
Actually, your stomach, just make your fist.
Like this.
This is the size of your stomach.
But
so,
the size of
this is the size of your stomach. So
like
if you
this.
take food that is bigger than this, you are overeating. And of course, the stomach is like a balloon.
If you don't eat well at night, you can't sleep well. I'm
No.
talking for viewers now.
And
I'm talking for viewers because I've been having this feedback from people when you say, look, sometimes, you've been here before and you did say that, in the morning eat like a baby, in the afternoon eat like a king, and I eat like a servant. When you eat like a servant at night, you'll be toasting on your bed, you can't sleep well. Why is that? And how can we tackle that? Because I'm sure that stems from eating before 7 p.m.
yes.
Yes.
One particular meal time that adds people a lot is the late night meal.
Yes, that's it. Because they want to sleep well at night.
Because
that's why they eat well.
That's why they eat well.
Yes, so that they can sleep well at night.
So what's your definition of eating well? You have to define what you mean by eating well.
Eating well.
Because I remember my mother-in-law, when I said, look, Mom, this is what you're supposed to do. She said, look, my pikin, if I don't eat well, I won't be able to sleep well at night. And if I don't sleep well at night, I'll be tossing on the bed. I want to go to bed and I'm gone. So I have to eat well. That is what they say. See, I'm talking to you because of the feedback I've gotten from a lot of people. Since you are all wellness coach experts, let's call it speed and know how to tackle the issue.
It depends on your definition of eat well. In the morning, he has already taught us what to eat in the morning.
You eat like a baby.
Yeah,
eat cereal, eat fruits and
veg, juice to help the detox. Because in the morning, that is when you are cleansing the body.
Okay.
In the afternoon, that is when you can eat your heavy, your swallow, your anything you want to eat.
But it must be like this.
Yes.
Okay.
Now, let me explain. When you eat this, your feast, your stomach is actually filled up.
The quantities.
Yes. But because we are not disciplined, we want the stomach to expand like a balloon.
So now that the stomach has expanded like a balloon,
You can discipline yourself because if
And
you tell yourself,
can it shrink back?
yes, it can shrink
Okay.
back. For example, if you decide to continually eating this quantity of food,
Yes.
after some time,
That's
when you force it more than this, you will react to it. You will be forced to go back.
You'll be uncomfortable.
You'll be
right?
uncomfortable.
Okay.
You'll be uncomfortable. So all you need to do is just to discipline yourself.
But is that the best option?
Of course not. That's what I said. I said they are eating to fill their bellies. They are not eating to nourish the cells. So they eat, they fill the belly up, and the cells are malnourished.
Do you like now? Actually, the food we eat and goes. We eat in line with our profession.
Okay.
Because if I am an Agberu, for example, I carry load.
And you're always shouting.
Yeah.
And running up and down.
Yes, and I'm carrying loads under the very hot sun, big loads, medium size, small,
Yes.
you know.
You should eat apple.
Yes, I should eat the heavy one in the afternoon.
Okay.
And I'll drink plenty of water. But if I am sitting in the office, I'm a sedentary worker.
Yes.
I sit all day in the office or somewhere in my shop or something, sitting down most of the time. Of course,
Your
I
diet
shouldn't
should be-
consume the same quantity of heavy duty food that those men who carry heavy load eat.
Okay, so let me ask you now, wellness coach. This is my cameramen that are looking at you now. Are they doing heavy work?
No, they are not.
So why are they always requesting for iyon and bar and such heavy food?
It is a Nigerian factor. It's a Nigerian thing, and it is
So,
psychological.
Yes, I think so.
It
Because
is.
I mean, a
See
cup
their
of
skin, very fine skin. Which load have they carried?
Don't mind them.
They don't see under. Look at this one's skin.
But he would like to eat apple, he wants to eat a bar. I said, no, take toast bread, a slice of bread, and some eggs and tea. No, madam, no, I'm not Oyibo. That's the kind of thing. That's the feedback you give to me.
It's Health Mornings, the #1 health show.
Memories are created daily from events, photo, and video shoots. Having the perfect studio, equipment, and right team is everything. That's why I completely trust Arwell's Media with my event coverage, studio space, equipment, photo, and video shoots. You too can have your memories and ideas created at premium quality by dialing 0701 699 6787 or send an email to jybtvonline@gmail.com. Arwell's Media is easily accessible at a secured and serene environment at number 6 Ajumobi Street off Acme Road, Agidingbi, Ikeja, Lagos. Arwell's Media, solving problems, executing visions, and giving value.
It's Health Mornings, the #1 health show.
I want to say a big thank you for staying with us throughout Health Monitor again today. And of course, we want to appreciate True Care Fertility Clinics and of course, the body care part that was brought to you by Abeke and Rema. Okay, they've told you, I know in your heart you might be swearing, don't swear for them, but they are this for your own good. Okay, so don't be angry that they are telling you not to eat the way you like. It's for your own good, all right? Thank you so much for being there. Please contact us in case you have more information that you don't want to disclose publicly. They will talk to you privately. It's Health Monitor, so thank you, and want to catch you again next time on the show.